COTU will from now on do the lobbying on behalf of doctors. The agreement to have COTU step in was reached on Sunday after the Medical Practitioners, Pharmacists and Dentists Union met COTU at the Solidarity Building. But as COTU takes up the negotiations, the doctors' strike will still go on.
We have agreed that we do lobbying between today and Tuesday so that we can see if there is any tangible, amicable agreement, because we want doctors back on duty, and equally we want government to respond positively.
On Tuesday, COTU will be reporting back to the doctors if the government has agreed to negotiate and how much they are willing to give to the medics. Both COTU and the doctors' union have dismissed excuses that the government has no money and instead told the finance minister and his public service counterpart to chair a meeting between them and the doctors and say what the government can afford for now.
Let him chair that meeting and tell us how much does he want to give doctors now and how much does he think that he will convince next year the parliament, because the parliament has got also to approve the budget. How much does he want to put before the budget? Because, you know, money for the elections, we know the figure, isn't it? Money for anything, education, we know the figure. How much is he proposing? And then we will go with it. We will listen to him. Let him chair the meeting, and that is what we have been mandated. If he can chair that meeting tomorrow, from whichever area, even from Gatundu, we are willing to meet him.
Besides a 300% pay rise, the doctors are concerned that the welfare of patients is substandard, both in and away from public hospitals. They say the money set aside for patients daily is way below economical and that non-governmental organizations are running a large portion of public health in the country.
The government allocation per patient per day is only 41 Kenya shillings, and this is the money that the hospitals are expected to use to feed a sick patient in Kenyan hospitals. In a recent mortality meeting at Madhari Hospital, it was found that one of the patients who had died of asthma, and the hospital does not have a nebulizer, which is a very cheap equipment that is used to assist patients who have acute asthmatic attack.
Dismissing government's recent offers as propaganda to hoodwink the public, the doctors said they are willing to do everything possible for a better health service.
The doctors in Kenya are prepared to go to any extent to protect the dignity of the Kenyan patients, including mass resignations from their positions as doctors working in public hospitals.
The meeting also sought to clarify that the 7.4 billion shillings that the government has offered as extraneous allowances, only 290 million shillings will go to the doctors, which is not anywhere near their initial bargain.
It is not 7.1 billion. That is the worst propaganda any government can put in place. Worst propaganda machinery that any government can put in place and say doctors have refused 7.1 billion. Some of government ministries are run by 2, 3, 4 billions. How can the whole doctors who number about 2,000 or less than 2,000 refuse 7.1 billion? How? How on earth?
The doctors' strike will be entering its 8th day on Tuesday, and the fate as to whether it will go on will be known on that evening. A day-long meeting at Afya House on Friday that was attended by the Public Service Minister failed to break the doctors' strike. John Maura, GBS News.